Here in Oregon in 2021, there was about 4 times the number of suicide deaths by firearms compared to homicide deaths by firearms. In fact, 76% of firearm deaths in the state were suicides. Looking at our most current suicide data in 2023, we unfortunately lost 890 lives to suicide in our state, which is an increase from our previous year. Much of the research and clinical focus in suicide prevention has historically been on why a person attempts suicide. In an effort to answer this question, we're often seeking ideas and ways that we can relieve mental distress that leads to a suicide attempt. And of course, understanding what brings a person to thinking of suicide is really important. However, it's not the only factor to consider, in part because the progress we've made towards answering the question of why hasn't prevented all that many suicide deaths. But how a person attempts plays a crucial role in whether they live or die. So lethal means counseling really helps us address the how.
So Charlotte and I have been helping our state address this for the past 3 years as co-developers and lead trainers of Oregon Calm, Counseling on Access to Lethal Means. Calm is an evidence-based, high-fidelity national training program. Calm and Oregon Calm were developed to assist healthcare and direct service providers approach lethal means counseling with an informed, collaborative, and respectful attitude. Many individuals find it challenging or scary to talk to people about suicide, and now we're asking them to add another sensitive topic like firearms to the conversation. So we really want to help build those skills and confidence. The training presents lots of public health data about suicide and access to lethal means. It highlights the importance of removing access to highly lethal means, talks about what means are most lethal, and describes how to have culturally responsive conversations regarding securing lethal means and firearms.
The overarching calm approach matters because the lethality of a suicide method is one of the biggest factors in determining whether a person lives or dies. Ready access to lethal means is especially concerning when we know that attempts can occur rapidly and with little to no planning. Research actually shows us that nearly half of all suicide attempts escalate from ideation to an attempt in 10 minutes or less. But we also know that suicide crises are often brief, that more than 90% of people who survive an attempt won't die by suicide, which is really hopeful, and that most individuals are at least somewhat ambivalent about their wish to die. This is why creating time and distance between individuals who may be struggling and lethal means, especially firearms, can and does save lives. In addition to its role in suicide prevention and intervention, like we've been discussing, we can also think about calm as a form as primary upstream prevention, meaning that we can have these conversations with individuals who may not be thinking about suicide, but they're just going through a really rough time in life. If we can help them create time and distance between themselves and lethal means, their environment will be safer if a suicide crisis arises.
Something that we think makes Oregon Calm so effective is that it is neither anti-gun nor anti-medication. The training really welcomes both individuals who may own firearms and those who may not. Recognizing that having that mixed audience with a varied background really enriches our conversations. Plus, it's ideal for everyone to work together to reduce firearm deaths, right? Whether somebody owns a firearm or not, suicide prevention is an area where we can all find common ground. To help build skills at the ground level, there's also a brand new community version of Calm available. It's called Conversations on Access to Lethal Means. And it includes some of those basic community helper skills, sometimes referred to as gatekeeper skills, plus adds that really important component about access to lethal means. Both Oregon Calm and Oregon Community Calm are based on research and lessons learned from individuals who live in Oregon and own firearms. Bringing their lived experience forward has helped guide us in how best to navigate these potentially polarizing conversations around decreasing access to lethal means. This training is appropriate for direct service providers defined very broadly. We're a social enterprise inspiring hope, encouraging individual and collective action, and creating change for healthy communities where all people can thrive.